Well, welcome back. I'm here with Dr. Alan Thorson and Joey Loth. Thank you both for joining me today. It is Colon Cancer Awareness Month.
Yes.
So we're here to talk about that. And Dr. Thorson, you are a colon and rectal surgeon and an advisor to the Great Plains Colon Cancer Task Force.
That's correct.
Yes, and like I said, I saw you last year at the Boxer 500, which is one of my favorite 5Ks.
I'm glad to hear that.
Raising money for colon cancer. But yeah, let's just talk a little bit about what is colon cancer? I mean, let's just talk a little bit about that first.
Oh, well, colon cancer is just a growth that starts out in the lining of the colon or the rectum. It's one of our GI cancers. It kind of presents silently. It doesn't really give too many symptoms until it's advanced a little bit, so that's why we make March Colon Cancer Awareness Month to tell people how they can best try to avoid colon cancer.
Well, then let's talk a little bit about that, about screening, about prevention, and so what are you encouraging people to do? I mean, probably all year round, but especially during this month.
So, well, actually, yeah, it is all year long.
Yeah, absolutely.
But we get to talk about it more this month. So, probably the most important preventative thing we can do for colon cancer is to get screened. Okay, screening means getting examined when you reach a certain point in your life.
Okay.
And now that point in your life is at age 45.
Okay.
And people who need to be screened are those who they think they're perfect. They have no symptoms, no bowel problems, no bleeding, no family history. All those things mean you need to be examined. But for screening is the people who wouldn't normally think about it. And they just reach age 45.
Okay.
They need to get it tested.
So that's when you really need, to really get that on your radar screen.
Yep.
Moving forward. And Joey, so you're a survivor of this. So talk to us just a little bit about your journey and how this all, the path that you've taken.
Well, when I turned 50, the age was 50 when you were to get screened. And at that time, I didn't have, insurance was different. It was right before ACA kicked in. And so you didn't have all the preventative and the screenings that are included in those programs, in those policies now. And so I was turning 50, independent contractor, high deductible, so I didn't have that, so I skipped it. And a lot of my symptoms were masked because I was also going through menopause.
Okay.
And so it was March, and I started noticing, that's when the symptoms started to present themselves in a more severe way. I started noticing blood in my stools, the bloating and such I'd always attributed to my age.
Sure.
And I had a high deductible, no pre-existing condition for 1 year policy because I was an independent contractor.
Yeah. Yep, I understand that.
I thought, well, I'll get on Google. So I had a kind of an idea what was going on. And I thought, I'm going to wait. I'm going to hold out for Obamacare to kick in because then no pre-existing and I'll be good.
Yeah, because what year was this?
This was, it was in 2012.
Okay.
So it was in Obamacare kicked in 2013. So that was in March. By June, the symptoms, and I had a slow growing tumor. And so it definitely would have been caught had I had been screened at 45, more likely.
Okay.
I have no family history. I have 10 brothers and sisters as well with no family history. So I'm a really good example as don't think you're immune to this.
Right.
You're still there. But anyway, by the end of June, I realized that I couldn't wait. I had, narrowed stools, blood in my stools. And it's subtle. It's not blatant. Like a lot of, it's not real obvious when people see it. I also had, one of the other symptoms is you feel pressure on your bottom, like you have to to go to the bathroom, but you can't. So I went to One World Community Health Center and said, hey, this is what I have going on. And I know doctors hate to hear that you say you Googled. Right. And that's the first thing I said. But anyway, they put me in touch with a program called Every Woman Matters, which has a colon cancer screening process. And that's how I met Dr. Evans at Midwest GI. And it probably took longer to go through the sign up with Every Woman Matters. But once I met with with Dr. Evans, within 3 days I had the I had the colonoscopy, and I woke up and he said, Joey, you have cancer.
Wow. Yeah.
So, and within 2 weeks I met Dr. Turnett with the Colorectal Cancer Center, and started treatment.
Okay. How do you, so talking about screening, so you're talking about the different symptoms, and then you finally went and got checked out. When did you, when was the day, was it 2012? When did you get
September
diagnosed?
26th.
Okay. So take us just a little bit through the process of the diagnosis to what happened.
I pretty much had come to the conclusion, and this is, I mean, to be graphic, I knew I had a really large polyp or the worst hemorrhoid ever.
Sure.
You know, and
Yeah.
and I remember Dr. Evans saying, "Oh, it could be diverticulitis," and I said, "I don't mean to be an armchair Google doctor, but I'm already accepting of what I'm probably have going on."
Yeah.
And basically, you know, I got on Google right away. I mean, I did. Again, I wanted to be, I had already kind of had an understanding what the journey was going to be. And the first thing they wanted to check, so within 24 hours, he had scheduled me for an MRI and a CT scan,
Right.
a CT and then MRI, because they knew it was far enough. When you go into for the colonoscopy, yes, the prep is uncomfortable.
Right.
But let me tell you a little bit about my side effects.
Yeah.
And the prep's worth it.
Yeah.
You know,
for sure.
but within 24 hours, Dr. Evans had already gotten a hold of Methodist and the colorectal center, and I was scheduled for a CT. They saw suspicious spots on my liver, so they organized the MRI, and were able to, you know, eliminate that as they were not as malignant or anything. So, but they could see that it had gone outside of the colon or the rectum at that time. So then, you know, you kind of, it was, you know, the wait in between.
Right,
And then meeting
for sure.
with Dr. Turnett. And so Dr. Turnett immediately, you know, we went in for a consultation, and the very next day had me scheduled for a sonogram to stage it. And I was stage 3B, which means that the tumor had grown outside of the colon.
Right.
And was affected. We knew that we had at least 3 lymph nodes that
Yeah.
were also affected, but we were able to see it hadn't gone any further.
Sure. So we talked a little bit about family history. Like you said, it doesn't show up necessarily in your family. I mean, you can just be A-OK, 100%. As people go through, if they find out this, as they go through the treatment, because again, I just kind of go back to the walk, met so many people in that walk that are a survivor of that. And let's just talk about kind of that survival rate and what does that mean with colon cancer? You know, is it very treatable? Is it?
So yeah, we can talk. I think that's probably an important point to make. You know, if you're doing screening, actually screening allows us to do 2 really important things. One is that it can actually prevent most colon cancers, because we know that most colon cancers arise from polyps.
Okay.
And for the usual progression from a polyp to a cancer takes 5 to 10 years.
Wow.
So that's why when you're screening, you really only need to, unless you have additional risk factors, you only need to have an examination if you're doing colonoscopy once every 10 years. Now, if you choose some of the other methodologies for screening, you need to do it more often. There's stool blood tests. You have to do those every year to make them effective.
Okay.
There's a stool DNA test. You have to do every 3 years to make it effective. And if you do any of those tests, if they come back positive, you need to have a colonoscopy. But so I forget where the question was going.
Well, we're talking about, like, you know, you find out you have cancer, the treatability of it.
Oh, yeah.
Yeah.
So you can prevent it. I needed to get that point in. But
Yeah,
also,
for sure.
the other thing that colonoscopy can do, or screening can do, is if you do have a cancer, you can find it when it's at an early stage. We had symptoms here that was a little bit more suggestive, a little bit more advanced than
Sure.
it was, but still treatable. But the earlier you detect it, the better it is. If you have a stage 1 colon cancer, survival, 5-year survival is in excess of 90%.
Okay.
If you have metastatic disease or stage 4 colon cancer, then the 5-year survival drops down to around 5 to 10%.
Right.
So we didn't have stage 4 here,
No.
so that was
Yeah.
good. But so it makes a big difference.
Absolutely.
A huge difference.
To get that early.
And one of the things is that's the first thing that I was looking at. Had I been screened at age 45, I had a slow-growing tumor. There's a very good chance they would have caught it at stage 1,
Yeah.
stage 2, or even prior.
Maybe a
It could
polyp.
have just been a polyp, but I didn't. And so, it went to stage 3B.
Right.
So it was over a year of treatment, just
Right.
treatment.
To dip that. So where do people, getting screened, do they just call their doctor? I mean, do they go to a specialist? I mean, how does that all work?
So I always tell patients that they're their own best advocate.
Okay.
So they should ask their primary physician about, if they haven't been told about screening by that physician, they should ask about it.
Okay.
And then if they don't have an answer, yes, need to be done. Let's say you're 50.
Right.
And you haven't been screened yet, and you think you Googled, and you know, oh, I should be screened.
Right.
And if you ask your doctor and they say, no, it's not important, then I just say you should go to a different doctor, or you can call directly to any of the endoscopy centers.
Right.
Dr. Evans, my center with Dr. Turnett, that we do colonoscopies. You could, or you could go, online, you can get kits for stool DNA testing if you wanted to go that route.
Okay.
There's lots of ways to go about this, but it's important to be your own best advocate, because
Absolutely.
sometimes I can just tell you need to be screened. So
Absolutely.
don't skip.
Yeah. I mean, we know our bodies, and it's up to us to take care of our health. So the Colon Cancer Task Force, people can go there, the website, to find out more information.
Yes.
Okay.
Yes.
And that website is?
Great Plains colon. Oh, gosh.
Actually, coloncancertaskforce.org. I was giving you a test.
Yeah. I can go there, but my fingers go where they belong, and I don't always make that. Yeah.
Well, I want to thank you both for coming and sharing. First of all, thank you, Joey, for sharing your story. The important message is, regardless of what time of year it is, get tested when you hit that age of 45, for sure, regardless of whether you think anything's wrong or not.
If you think something's wrong, you need to be.
Yeah, for sure.
You need to get a diagnostic exam, not a screening. Yeah.
All right. Well, thank you both so much for coming. Again, Colon Cancer Awareness Month, coloncancertaskforce.org for more information, and we will be right back.